Great. We'll let people in. Okay, with that, we can get started. Welcome to the 22nd Alameda County Community Advisory Group meeting. We have live interpretation in Spanish and American Sign Language. First, maybe we'll make the announcement for Spanish language so that everyone can select a language. Maria, maybe, or Laura, if you want to give the instructions. Oh, you are muted, Maria, but you look like you're speaking.
Buenas tardes, bienvenidos a la Junta del Condado de Alameda. Tenemos esta junta en inglés y español. Si ustedes quieren la interpretación, seleccionen el globito en la parte baja de la pantalla, escojan español, pero también si quieren participar tienen que escoger, pero si hablan inglés, escojan inglés. Bienvenidos.
Perfect. Thank you. I will turn it on. So for everyone, just as a reminder to please select your language if you are listening in English or Spanish. And you can use the globe at the bottom of the screen. We also have live closed captioning here today. Thank you for our captioner. And we have interpretation in American Sign Language. And for those of us watching on YouTube, there's only one screen can be highlighted at a time. So we'll make sure that our interpreter is featured. Finally, as a reminder to our speakers to speak slowly for our interpreters, and for any attendees, you are invited to put questions or comments into the chat. Finally, please mute yourself if you are not speaking, and we look forward to hearing from you when you are. Okay, I think with that, I am passing it over to our co-chair facilitator for the night, which I think is Greg Hodge.
Lauren, thank you. Welcome, everybody. It's good to see all of you tonight. And as we get started, as we always do, we want to acknowledge our Native American brothers and sisters, the Ohlone people, and whose land we all sit if we live here in Northern California. They were stewards of this beautiful place that we call home here in Alameda County. They were fisher people and really took care of their land, and their descendants are struggling to keep their language and some of their traditions. And so as we think about traditions tonight, we also acknowledge all of our ancestors. As a person of African descent, and I think about all of my ancestors who made life possible wherever they were, despite some really sometimes very tough social and physical conditions. We also want to celebrate a little bit because there's some good things that have been happening. We all are still, I think, we got to find good news somewhere. And the elevation of Justice Ketanji Brown Jackson to the Supreme Court, most of us have been still celebrating that as a woman, as a Black woman, as a jurist, as an intellectual, somebody who was a public defender in the early part of her career. So we are still very happy about that. And at the same time, we want to acknowledge all those folks who we've lost to this dreadful pandemic as we continue to stay in a state of readiness and get ready for the next phase of all of this, as well as the scourge of gun violence here in our community. As some of you may know, Oakland it's just been horrific, and we know it's been happening in other parts of the county. But on Sunday, a 15-year-old girl who was visiting relatives here from Antioch was shot and killed in East Oakland. And so we see all of that as part of our overall public health and wellness. And if we just take a moment of silence for all of the folks that we've lost during this pandemic, as well as those we've lost during this scourge of gun violence, so we just take a moment for them. Thank you all very much. And so as we get into this, we got a pretty full agenda, as we always do. We're going to start with some updates, lessons, and advice from the field. We want to hear from our community partners to set the stage and the tone for where things are going to head next. We'll hear updates from our county partners, and then we'll hear a little bit about the need for a strategic refresh in the county, and Kim and Donato will help lead that off. I remind folks too to speak relatively slowly and clearly for our ASL interpreters, as well as for our Spanish interpreters. And I have to remind myself of this often because I tend to get going and talk too fast. And so we're going to slow it down just a bit to make sure that everybody can participate. So with that, I want to open this up and invite some of our community clinicians, starting with Dr. Noha Ablada, and then others, Dr. Carey, Dr. Rhodes, others who are on the call to give us a sense of where we are from your perspective in terms of how we are dealing with day-to-day issues with COVID, as well as getting ready for what we know is coming as the next wave of this. So let me start with Dr. Ablada. Hey, Noha, how you doing tonight?
Oh, well, thank you. Well, I think, right now what we are thinking about and wanting to maybe be in more discussion about is what are the metrics that we should all be looking at to know how we are doing in the pandemic. And then how will we respond to those? What will we do to act on those? And so I know that there's sort of talk of wastewater surveillance. Not clear exactly how that's going to inform our actions, and would love to learn more about what our leaders are thinking in that regard. Also just wondering about, as more folks are doing home testing, are we thinking about somehow collecting the information from those tests so that that can help inform where it is that we are in the pandemic? And then I think one thing that's really important that I think a lot of community members are still not aware of is the now, thankfully, availability of treatment. And so what I've been sort of saying is, if we have any more people who are hospitalized or die from SARS-CoV-2, I'm asking questions, right? And we all should be asking questions. Of course, the biggest differentiator is vaccination status. But now that we have treatments available, we want to ensure that every single person in our county is aware that they need to get tested and get treated absolutely as soon as possible. And one of the things that I'll say we're hearing and seeing on the ground is that because the scale of the pandemic response in terms of testing and vaccinating and so on, and all of the particulars of how we had to address this infectious disease, to a large extent, the primary care providers were not really involved in the response. Many primary care providers weren't really doing testing, and many still don't have vaccinations, for example. So now that treatments are available, we're actually hearing some patients saying that their doctor doesn't know about it, or I don't prescribe it, or things like that, it's very concerning. And it's, I would normally say, but that's unacceptable, but I also see, how that happened, and that we really need to be thinking about bringing primary care providers into the fold the entire pandemic response, testing, vaccinating, and treatment, particularly because we are seeing some of the sites that were put up kind of packing up and leaving. We want to make sure that residents know how to access all of the above. So I think those are some of the highlighted things that we're really thinking about, and wanting to know how we're using this time, which is a lull. I don't think anyone here thinks we'll stay like this forever. And so how are we using this time, I think, to gear up, to prepare, to know what metrics we should be looking at, and how will be communicated to the community that, okay, it looks like we're upticking, and then what does that mean? Are we reinstituting, for example, mask recommendations, or re-implementing some types of additional guidance? So I think that probably sums up where kind of what I'm thinking about right now.
Cool. Thank you for that. Let me invite Dr. Carey as well. And then I know Tanya Dennis from Oakland Frontline Healers wanted to add something as well. But Dr. Carey, anything you want to add? And we open this up to other community partners as well. Anything else that you all feel like we need to be paying attention to right now?
Yes. Hi, good evening, everyone. I will completely acknowledge and appreciate everything that Dr. Noha just said and agree wholeheartedly. The couple of things that I would add is number one, as my pediatrician hat on, thinking about our children and when vaccinations are going to be available for the youngest of our members of our community, and thinking about just the strategy that we're using in our schools around masking, testing, and vaccinations. So really thinking about, as we are likely to have a surge in the fall, how are we going back to school, and what are we asking our schools, how are we asking them to be prepared? The second thing I think I'm hearing a lot about is the boosters and the ongoing shots, and why, if the cases are so low and hospital rates are so low, why are we still continually pushing for booster shots, and how many more shots are coming? So I think coming up with a communication strategy around boosters and the importance of continuing to make sure that your vaccination status, that you remain as, your antibodies remain as high as possible. We're really getting that message out to the community about why vaccinations are important, even while cases remain low. And then the other piece is thinking about the community response from community-based organizations and faith-based organizations, and how during this pandemic we really rallied to answer the call for assisting with the pandemic in terms of messaging and testing and vaccinations, and how do we continue to keep community organizations engaged now that we're sort of settling back into a normal, and being able to immediately respond using the infrastructure that we built over this last 2 years, and not allowing that infrastructure to crumble. And then if we need them again, now we have to rebuild. So really thinking about how do we keep our community-based organizations and faith-based organizations involved and on the ready during this lull, so that they're still prepared and ready to meet the needs when it arises again. Those are my thoughts. Thank you.
Cool. Thank you for that. Tanya from Oakland Frontline Healers.
Good evening, everyone. As we're in this lull, we really need to consider the COVID fallout of homicides and the mental health crisis that we're experiencing in our community. It's really becoming a state of emergency in the Black community. And in talking to the Association of Black Psychologists, I was told that the only way we can get a evaluation for our health is to go to Santa Rita jail. That tells you right there you have to commit a crime in order to get your mental health issues addressed. We know that COVID, with shelter in place, with the lack of entertainment, with the lack of being able to come together, or even having to live with your domestic partner who's violating or is violent, has escalated the violence in our community. And we're not addressing that. Yes, we're addressing COVID. We're doing a good job. But what are we doing to address the mental health crisis, which is a public health issue? And Oakland Frontline Healers has taken the lead on that with the partnership of the Association of Black Psychologists. We just put forth a request for Barbara Lee to allocate $1.5 million to establish 3 African-American healing hubs. Our people need to be able to go somewhere that are traumatized, that are in fear, that think that they're going to do something dangerous other than to the police. So I'm asking us to put this on the table. We can't, address it when it's too late. We just had this shooting in New York. It was a Black man. And Black people all their lives have always prided themselves that when there was a crazy mass shooting, no Black person was crazy enough to do that. Here we are. So we can keep ignoring it, and we're going to see more of it. We need to address it. Thank you.
Mm-hmm. Yeah, thanks, Tanya. Other voices, anybody else from our community side of this partnership that want to add anything to sort of where we are, where we think we're headed with all this? Yeah, Michelle.
Hi, good evening, everybody. Michelle Smith McDonald from Alameda County Office of Education. I just wanted to share, as we were addressing some of the issues around schools, I wanted to share a couple of things that we are working on in partnership with our public health partners. So our schools are preparing now for the new school year, and we are working on our guidance documents and our conversations about what sort of state guidance will be coming down to serve our schools as they begin the new school year. And we are continuing to have conversations with our school leaders. We've had more than 90 calls at this point with our school leaders and our public health officers. And those calls are going to continue through the end of the school year. Additionally, I want to share, and I don't have a copy of it quite at the ready, but we do have a flyer that we've prepared and we're in the process of getting translated that talks about a concept called mask season. And, as we have other seasons and we take other precautions for allergies or for wildfire smoke, that we will continue to need to be flexible about our use of masks. And so we are working on getting that information out to our communities. And so I want to credit public health for the mask season concept, but we've created what we hope is some engaging language around that. And we'll start pushing that out into our communities as well to let folks know that those mask related things could shift, and that people, that our students could be back in masks at some point, and that we'll need to continue with that level of flexibility. But I just wanted to give you an update as to what's happening with our schools and the conversations that are happening as we have about 8 weeks left in the current school year, but are certainly turning already to preparations for the fall of 2022.
Yeah, Michelle, one question since you have the floor.
Sure.
Anything you can add in terms of the mental health question, particularly for students and teachers in public schools? Because I know that anecdotally, there's a lot of kids who are really still struggling. And so I'm just wondering, like, what has been happening in terms of that part of the situation?
Yeah, thank you for asking that question. It has been definitely something that everybody's had to put resources toward. So we had begun our social and emotional learning team at ACOE and have ramped up those efforts and increased our staffing along that line to provide trainings for staff, curriculum for school staff. We are working with individual districts on what their plans are. We know that some of our districts are for the first time ramping up wellness centers. Some of them may have had small wellness centers to start, but that's definitely becoming a priority from a resource perspective. But again, it's going to be a matter of resources. We have COVID funding in our schools right now that will expire at some point, probably by the end of 2023. And so how many of these initiatives that folks have created in response to this that can meet a longer term need, will they be able to keep? And so there's a lot of advocacy happening right now around being able to maintain resources so that some of the structures that have been built will be able to hang on to.
Okay, thank you for that. Anybody else from the community perspective, anything else you want to add to this before we turn this over to Kimmy and our public health team?
Brother Greg, I might just want to add one other thing that I forgot to mention, which is about what does our planning and assessment, if any, look like as it relates to ventilation in our indoor spaces, including schools. I kind of think about the grades that the public health department gives to restaurants, like an A, B, C, D grade, and I don't know if that's something that's in the scope of possibility. I realize this is a huge, huge list, but even thinking about beginning with our schools or settings where we know that we do have a lot of mixing of vulnerable populations. And so just also wanting to know if there are plans around either equipping small businesses, large businesses, schools, and other venues, or assessing them, giving tools or grants, or however that may look. But I think that it will be very reassuring for the public to know and to understand what is the adequacy of ventilation in a space they're going to enter, particularly as masks become, not required, or as they are not required.
Yeah, cool. Thank you for that one. All right, unless there's anybody else who wants to add anything, let me turn this over to one of our other co-chairs, as well as actually both of them. Nestor is going to be on to help facilitate this part of the conversation. But Kimmy, I can start from our public health department. You all have something you want to share, as well as any responses to some of what we talked about. And I know in our planning conversations, we raised some of these issues, and we've been thinking about, well, how does this become part of this broader strategic refresh as well? So, but with that, let me turn it over to Kimmy. Hey, Kimmy.
Hi, welcome everyone. So as everyone was talking, I was actually taking notes because some of what you're saying, or really all of what you're saying, are things that we need to factor into our strategic refresh as we think about what's the next phase of this work with COVID. And so Donata and I will be having a conversation with you all later on in the agenda around this particular issue, including how we think about those things that are after the after effects,
striving for a more equitable world.
The things that came as a result of COVID, like violence, like mental health, strain on people's mental health, all of us. I mean, it's been a lot. And so we want to keep those ideas flowing. And so we'll have, like I said, a little bit of conversation at the end to really ask how this CAG wants to be involved in helping us to refresh our strategy as we move forward. So, but at this point, I'm going to turn it back over to, I think, Nestor, you're facilitating, but it's Dr. Moss and Donata giving their update on where we are, what's going on.
Dr. Moss, is this you?
I think it's me first. So thank you. Good evening, everyone. I'm glad to be here. I thought that it was a good opening session and comments there, and some of which I think we'll be addressing in more detail in these slides, and other things that I really look forward to engaging with this group on how we can better bake into that strategic refresh that Kimmy mentioned. So we are at 7.3 cases per 100,000 residents per day. This is up. We are up from our lowest point of 5.8, 1.9% test positivity. We are at still at a fair amount of testing being done, 8,500 reported lab tests per day. I look at this on our dashboard, and I give it a week delay for all the data entry to go in. 53 people in the hospital, 2 in the intensive care unit. We were actually yesterday at our all-time low of intensive care unit hospitalizations at 1, lowest point we've been in the pandemic. 270 deaths since January 1st. we have, in the last, I'd say, week or so, we've definitely seen an increase in our reported cases. It's not dramatic yet, but it is a difference. And so we're watching that closely. We'll talk a little bit more about that. Next slide, please. This is a slide from a week ago, our daily reported cases. We'll update this slide on Thursday. And you can see things were really quite quiet up through the end of March. But I do think when we revise this slide, we're going to start seeing numbers more like what we saw in early March and February. And the question is, do we continue to increase from there? Is it a ripple? Does it become a wave? And how do we respond? Next slide, please. Our wastewater data similarly showing an increase. You can see on the far right. So this is going back to November 1st. And you can see really since the middle of February, we've been at these very low sort of pre-surge levels. And just up through, this is data up through, I think, April 7th. We have seen an increase. Now, this is just the northern part of the county. We don't have a complete view yet. We are trying to see if we can add sites in the county so we could get a broader picture. But nevertheless, I think this is a lot of the county, and it's notable. We're seeing a change here. Again, not a full-on evidence of a full-on wave, but we should get more wastewater data. I believe we'll get the results Thursday, Friday, and Saturday. And this is on covid-web.org. You can actually look at this. So we'll be looking closely at that. Next slide, please. And this is just to share the national picture of the BA2 variant. It is this is through CDC estimates through the end of last week. It is I think almost 90% nationally, and the same here on the West Coast, almost 90% of specimens. So really, the story is BA2. As you can see, we have some signal. We're not in a massive wave, but this is if things take off, we're expecting it'll be the BA2 will continue to be the story for the time being. Next slide. We did see this secondary, the main winter surge peaking in January in Europe, and then in some countries, not all, this BA2 wave that has peaked and is now coming down. So that's fortunate. And the pattern looks very different in different places. So I think it's been tough to know for sure what this means for the US. Certainly other places have been seeing increases. I think New York most notably. And of course, testing is down in a lot of places. So you have to sort of not be too reliant on case data from all parts of the country. I think New York and the Northeast, there's still a lot of testing. California still has a lot of testing. So this is reported lab testing. So we have okay data from some places. We are not seeing this type of wave yet, but again, I think people are concerned it's coming. And it just may be that we see something like this before the fall or winter. I think we should have a better idea in the next week or so. Next slide. So the most important consideration as we look at these increases is when would we reintroduce masking? So we have said since the rollback of masks that this is something that we would do if we needed to. Some of you may have seen the city of Philadelphia, one of the maybe the only place so far to reintroduce the only political jurisdiction to reintroduce a mask requirement in the U.S. But I expect we'll see more if we continue to see increase in numbers. This would be a short-term thing to limit the severity of a wave, keep the numbers down, keep the impacts in our hardest hit communities as low as we can, try to keep the hospitalization numbers down. We as a potential off-ramp, we would just look at the CDC's new framework, which might work well as an off-ramp, doesn't work quite so well as an on-ramp. I don't think we would wait for CDC's high community levels to put this requirement in place. Instead, we would look at our case rates. So still, again, it doesn't capture home tests, but we do get a lot of laboratory tests reported. So I think in the coming weeks, that's still a reliable indicator of our trends. And we'll look at the reproductive number, which is, instead of just picking a case rate threshold, that looks at how quickly the numbers are going up. And we can look at it not just for Alameda County, but for the whole region. So if the Bay Area is heating up and we haven't seen it yet in Alameda County, we can look at that as well. Of course, our wastewater data, I showed you that already. I think if we see multiple measures suggesting that we're on this surge pathway, even if our case rates aren't showing that, I think we need to take that seriously. And certainly, if we don't see any signal but a rise in hospitalizations, we might go based on that alone. So there's a number of different things that could cause us to reintroduce masking. I think it's better to look at multiple inputs, since all of these can be a little bit muddy, especially with home testing and some of the other issues that we have with reporting. Right now, we get our local case rate data continues to be updated every day. The state has moved to updating some of both its public metrics and some of the tools that they make available to local health departments only on Tuesdays and Fridays. And in fact, they didn't update it today, so we're expecting that tomorrow. So at a minimum, we'll be assessing this Tuesdays and Fridays. It's a real it's a very easy time to look at what's going on in other jurisdictions, to look at our estimated R effective, which the state posts on their website. And I think it's really just a question of what happens in the coming weeks with this, with these increases. Next slide. I couldn't find a better place for it, but I wanted to just comment on second boosters, which were authorized since we were last together. They are now allowed for people who got Pfizer and Moderna, who are 50 and up. And they are also allowed for immune compromised people. So that could be actually a fifth shot for people who have immune compromising conditions. Also, a third dose is now allowed for everyone who got 2 J&J doses, a J&J initial vaccination and a J&J booster. And we support this expanded booster availability. Still not a lot of data, although there is some good data showing some benefit. We do know that when we see severe disease in vaccinated people, which is unusual still, but when we do see it, we see it in older people or immune compromised people more often than not. And the FDA, determined that the potential benefits outweigh the potential risks. We know these vaccines pretty well now; they've been very safe, and so that's why these additional doses got authorized. I think it's most important for people, the older they are or the more severe their underlying immune compromising condition is, and the further they are out from their booster shot or their COVID infection. So my great aunt's 100 years old. She had COVID in February, Omicron, she was boosted, then she got COVID. And, I told her she could probably wait a month or two. We could get more data. Maybe we'll see a surge later in the year. And so I felt that because she had a recent COVID infection, it was less urgent. My parents have not, to our knowledge, had COVID. They're 80. I said, yeah, I don't think, no reason to wait. Go ahead, get that protection now. So I think it's going to be different for different people for the time being until we have a little bit more data. But certainly for older adults, and people who are severely immune compromised, especially if they're far out from their booster, they've never had COVID, I think it's a good idea. Next slide.
Nick, if I can interrupt you just 1 second, like when you say far out, are you talking about like 6 months? Like
yeah.
Like,
It's so 4 months is actually, you need to be 4 months out to be eligible. So you can't even do it until you're 4 months out from your booster. But our big wave of boosting was in the late fall, early winter. So most folks are going to be 4 months out. But if you're 6, 7 months, you were the first person in line to get a booster, then I think it starts to be worth thinking about this. And I think if we're seeing more and more cases, and we get some more and more data, again, there's still not a lot of data about fourth doses. The messaging could change around this, not just locally, but at all levels. Next slide, please.
Dr. Moss, may I inquire, how are you, first of all?
Oh, hi, Gary. Yes.
Hey, yes. So there is no specific data that is indicating 50 and below for the second booster. And then what are our indications regarding our youth? Because as the dosage is wane, isn't there speculation that they'll need additional vaccinations as well? So where are we in that capacity?
And I think, when we finish the update, I would love also for some of the other physicians on the call who've been dealing with these issues, if they have opinions they want to share, because I think we're in a little bit of, people are going to potentially give different advice. So a couple things about younger people. So that the data, actually, the best data I've seen is for people 60 and up. In the US, they made it 50 and up. They just made it a little broader, but we have less data about that fourth dose in that 50 to 60 year range, at least that I've seen so far. And I don't think there's much at all yet for younger populations. And our youngest children both have been vaccinated more recently. So they're just closer to their initial vaccinations. And I think the boosters have now, somebody can correct me if I get this wrong, I think boosters have only been approved, first boosters have only been approved down to age 16. And so, it's really, the question is when they get that first booster. And of course, we see less severe disease in that population, relatively speaking. So that's also why there just is less data so far. And I should say, still the most important thing is to get that first vaccination. And that first vaccination provided a lot of protection during this winter for people who never got boosted. So one of the tricky things with boosters is making people feel like, oh, well, now you have to get so many shots that's not true. That first vaccination series really makes a difference. And our top priority is still getting people vaccinated who are unvaccinated. But I think, we'll learn more, Gary, and we'll probably see recommendations for additional doses for other people. But it's important to remind people, look, vaccination makes a difference, even one shot, but certainly we want people to get that initial series. That is the most important thing. And then, yes, we probably are going to see more people getting more shots down the road, but that's gives you extra benefit. But the big improvement, the big jump is going from unvaccinated to vaccinated. And that's even true for people who've had COVID. You hear a lot about, oh, well, I had it before, so I'm protected. The data is out there. In fact, new data just came out. Good data just came out this week. You're better off with the vaccination. So even if you had COVID before. So I wanted to cover this, though. I know there's probably more questions about the boosters, but the other big news, some of you have heard me talk about this in other forums. California Department of Public Health last week removed their quarantine recommendation for unvaccinated people who are exposed to COVID and who aren't feeling sick. So until recently, if you were unvaccinated and you were exposed, you had to quarantine. Vaccinated people have not been recommended to quarantine for some time, but unvaccinated people were. CDPH dropped that recommendation last week. Their justification was because these more recent COVID variants we have seen spread so quickly, quarantine is just a less effective intervention. By the time somebody quarantines, infection has already spread through the exposed people. Also, as part of their justification, just the high rates of vaccination, but also prior infection at this point. I think we have not made this change yet in Alameda County. We want to hear from you, from this group, and we want to hear from others before adopting this change locally. It's important to note CDC has not made this change yet. They still recommend quarantine for unvaccinated people. But on the flip side, I think Cal OSHA and the worker safety rules are here in California are going to change, and they are actually aligned with California Department of Public Health. So workers do not need to keep people out of work if they're exposed, as long as they're not sick. Regardless of who you are, isolation is still recommended by the state, by CDC. Here in Alameda County, it is a requirement. You have to stay home if you're sick. Quarantine is still required and recommended by the state in high-risk setting, congregate settings, shelters, correctional facilities, healthcare facilities. In schools have been able to keep exposed students in classroom for some time, that is still the case, and we are already aligned with California Department of Public Health on that. But it's more for the general public, we really want to make sure that it's the right time to do this. But it is complicated. So interested to hear from people tonight, if possible, on this change. And I think this is my last slide.
Did you want to go to this one, or?
I think this is Donata's slide. So maybe Donata, you want to go, and then we'll have the discussion.
Sure. I just have one quick update. I hope everyone can hear me. I have some internet connection issues today, so I'm going to leave my camera off. I just wanted to give you a quick update on what we're working on right now. We did talk about providing KN95 masks for our most vulnerable communities, especially those who are immunocompromised. So we are in process of ordering those in phases. Right now we're ordering a batch, and then we're going to order some more towards the summer and fall. We are working on a distribution plan. We're hoping to distribute those through our community partners. And we will be providing some recommended criteria or priorities just to make sure that they get to those who really need them. We're also working on continuing to make sure that we have test kits available for our communities. We do continue to support priority settings as long as we have the supplies, which we still do have. And we do have a priority distribution list in terms of who doesn't have access and who needs test kits. And so we're also working on assessing what future test kits, how many and where they would be needed in the future, to see if we need to purchase any for our communities. We're also working on some treatment navigation. We're working on a test to treat pilot. We're hoping to use a couple of our nurses to do some assessments of cases, especially for people who are testing at home. We're also working with our long-term care facilities to on some treatment options, making sure they have all the information about treatment options. And we're also working with some of our testing contracts who have expressed interest in providing test to treat as an option. So a few things going on there, and next time we meet, I will have much more information about that. And then finally, on our vaccine front, as you know, vaccinations are widely available. Our website continues to be updated with locations where vaccines are available. We also have our stationary pod sites available and continue to be working with our community partners to identify pop-up sites. And as Dr. Mouse mentioned, second boosters are now available to 50 and over and immunocompromised. And those are available through all of our, through not only our vendors, but our walk-up, pop-up, and pod sites as well. And I just wanted to give a quick update on our outbreaks and cases. As you know, our cases have been lower. We have also had very few outbreaks. We continue to screen priority zip codes for the ARCH stipends. We have about 430 stipends remaining. And the number of cases in our long-term care facility have remained low. We had, I think, only 23 cases last reporting period, both in cases and both in staff and in residents, and very few cases in Santa Maria Jail, 3 cases in residents and 3 in staff was last week. So we're just keeping an eye on what's coming and preparing for what's next, and cross-training our staff. And that's my update for today.
Thanks, Donata. Hi, everyone. Before we jump into some questions, Kimmy, I think you have an update around ARPA, or not yet? Is that, am I out of turn here?
I'm not sure, but I can give the update now.
Well,
So it's very brief. So as part of the Board of Supervisors allocation of the first tranche of ARPA dollars, they allocated $11 million for outreach and navigation and capacity development. They asked the health department to administer that additional $11 million. We held a listening session yesterday evening to hear from community partners around thoughts they had around how the money should be distributed, though we are more limited in that regard. It really must be an RFP that's done. The Board of Supervisors has made available community grants through their board offices. So each district has funds set aside for community grants, but for the 11 million that the health department will be managing, that will be through an RFP process. And so we got lots of wonderful feedback from everyone who participated. Some of you or your staff were a part of that call. And so we are going to be reviewing all of the notes and integrating that into how we structure the procurement. The timeline that we have is to have a procurement ready to open by summer. We're hoping the beginning of summer is our plan. And I think that's about it. So yeah, it was very well attended. And again, we got really good feedback from everyone who was there about how these terms that are thrown out there are understood in the community, how people see capacity development, how community partners see outreach and navigation. And that was important for us to hear how the community partners see these things. We didn't want to come up with a procurement with our own definition that doesn't really resonate with what communities feel these things mean. So that's all for now.
thank you, Kimmy. And are you all still accepting comments through email to the public information officer? Is that correct?
I think so, yes.
Cool. So yeah, folks weren't able to attend yesterday, but have some feedback that you'd like to provide. You could do so through the public information officer. I think we have about 10 minutes or so for any questions for either Dr. Moss or Donata or for Kimmy. I want to open up the space now for any questions.
And Nestor, I think, I think this, I don't want to speak for Kimmy and Donata, but certainly if people want to give feedback offline to me about any of these issues, and the quarantine issue is really something that we're hoping to, resolve this week. That is fine too, and we're available, or I'm happy to discuss with people offline. I think it's it doesn't have to be in this group, but certainly if people have thoughts, please share.
I see Dr. Bruce, your hand is up.
Yeah, I have a couple of questions. Since the CDC still recommends quarantining for unvaccinated, and the change is removing quarantine for asymptomatic exposed unvaccinated people, if you want comments, could you send us, at least on the committee, a note saying which do you feel the most comfortable adopting And can you give us any reasons? Because it's kind of difficult to just come up with what your reasons might be. And you have all of our emails and everything. And I think that would give you a better idea, because versus talking, writing down what you think is really an important way of expressing your feelings. The other thing that I'm wondering about is what the real number of cases are. And you know, home testing, you don't really know what the real data is, or data. And the government relies on lab results versus home tests. And now with the money going away, you definitely may have some problems with having what real home tests may be about, because not just lower income but and uninsured, but other people aren't going to have those tests available that easily now, especially if they need to pay for the tests. You don't have as many clinics that people might be able to go to. So who really knows what the actual numbers are, even in this county, as well as across the entire country. Those are my 2 comments right now.
I really agree with that last point. That's why we're trying to look at multiple data inputs. And I think Janada maybe can comment on testing. I mean, we certainly, supporting testing continues to be an important part of response. Both, I think, we want to support people's access to home testing, because obviously it has some real advantages, but also lab testing where we would get that information. It's never been complete. It's less complete now than it was, but I think we have enough. We can still look at trends with some confidence, especially if our other, like the wastewater data agrees. So far, that has been the case.
Wastewater is really interesting with what you can find floating around in it, so to speak, as far as information. Okay, thank you.
And I put it in the chat, but I'll also send a follow-up email about the quarantine issue, give people another chance to weigh in on that. Sorry, Nestor.
No, it's okay. Thank you, Dr. Moss. Any other questions, comments?
Yeah, I wanted to just appreciate Dr. Bruce's comment about sort of, I guess, a process piece, because I really appreciate Dr. Moss, you bringing this question to the community advisory group. And
I always sense it was harder for them.
If we could please mute ourselves. Thank you, Dr. Yeah.
And wanting to make sure that we're understanding how the community input is then also being acted upon. So I think that I like that suggestion, but I will give my 2 cents while we're here, which is I see Gary's comment about, wanting consistency, but no matter what, we've got the CDC and the state doing 2 different things. So now it's, who are you going to be consistent with? It's just not clear to me what problem is trying to be solved here, to be honest, and why we're going to have like a new communication about a fairly nuanced, smaller population. And it does bring a little bit of concern around what sort of the downstream impact might be for, let's say, a person who should probably be on quarantine because they had a close exposure, but now maybe perhaps because of the rule change, does that mean that they won't be excused from work, for example? I don't know the answer to that question, but it's just something that I want to be mindful of as we think about worker protections in general. And that has, there's been so many different impacts, but I just don't want to have that be a consequence that we hadn't contemplated. And then on the testing question, or what metrics we'll be using, one question I had is, do we know, are there places where just routine sort of asymptomatic testing is happening on any scale? I've been looking at the school districts and appreciate that maybe some routine surveillance. Are there other venues, industries, hospitals, places that are doing asymptomatic screening that maybe could give us a window into what is happening that maybe we haven't needed to look at before because we've had better indicators on the community level, but now that we don't, are those things that we've looked into or thought about?
I mean, that's a great question, and we haven't relied on that here locally, but I think you're right. That's something that we should look at. Healthcare providers, at least some subsets, some of those requirements have been rolled back in a lot of places, and even in schools, it's inconsistent, or they use home testing. Although that'd still be useful information. So we can look into that. We have Dr. I don't know if people in this group have met her yet, but Eileen Dunn has been with us for several months and has actually been tasked with sort of overhauling our surveillance system and trying to address some of these questions. And that's something that we can take to her, along with trying to expand wastewater, seeing if there's any useful, I think you brought this up, Dr. Abalada, seeing if there's any useful data that we can somehow gather from home testers, and what that could look like. There's a lot of challenges, and so I think that's something that we can include with that effort.
Any other questions or comments for either Dr. Moss or Donata or Kimmy? Okay, in that case, I will, let's see, is there, there's a comment portal or app to report home tests would be handy. Just go comment in the chat. I will turn it over now to, I think it's back to Kimmy. Is that correct, Kimmy?
Mm-hmm. Yeah.
All right.
So thank you for all of the questions. Again, we're taking note as well. For this phase of our work. So we've been now at this since March 2020, and along the way we identified a few goals for ourselves here, and you can find our current strategy on our website, but it's time for it to be refreshed with new goals, new objectives, using information that we have now about what has happened, what we know about COVID, what we know about our community, what we know about our vulnerabilities, what we know about our strengths, our assets, and all of those things. And so at this point, we also want that refresh to be a bit more participatory. And so Donata is going to give you a snapshot of kind of where we've been, kind of where we are, and then we'll have a little discussion at the end about how this group might partner with us for a strategic refresh. Okay,
Right.
Donata, turn it over to
Thank you, Kimmy. Thank you, Kimmy. So I have these 4 points here, really what Kimmy was just mentioning. We've been using this also internally for planning purposes. What have we done so far? Where are we now? Where are we going this year? And where are we going to land? So in the context of our planning, we really wanted to share a bit of what we have done in the COVID division and then share what our current focus is. And then at the end, I'm going to turn it back to Kimmy just to pose some questions to you. So next slide, please. So this slide is fairly busy, but I'm just going to walk you through it briefly. So on the top left, for our community testing, this is a mix of both the end of 2020, mostly through the end of 2021. But at the beginning of our community testing efforts, we far exceeded the statewide test rate of 3,100 tests per day. And we ranged anywhere from 4,500 tests per day to 27,000 tests per day during Omicron. That's of course in coordination with all of our community partners. We were able to build a community testing network, and that went really, really well. And we developed messaging campaigns that really met communities where they were at, really tailored those messages to the needs of the community. And the testing learning community that that Vasi and Jocelyn Freeman-Garrick was leading has been really successful as well, just getting really good input from all of our community partners. For our outbreak investigations, our special settings outbreaks have investigated over 1,400 outbreaks, and that includes our healthcare our transitional housing, unsheltered, unlicensed mental health and substance use disorders facilities, also our children, youth, and congregate settings, and our workplaces. So that's quite a few outbreaks that we've investigated, and many of those were in our workplaces, which had a quite a range of different types of workplaces. For our long-term care facilities, we investigated 497 outbreaks, and that involved over 6,000 residents and 5,000 staff. And Santa Rita Jail, we investigated 112 exposure events that involved over 1,600 cases and over 1,000 contacts. On the top right, our case investigations and community resources, we conducted over 65,000 case interviews. We served over over 6,800 households were served by our community resources team. We provided food deliveries to over 4,800 homes. We provided diapers, almost 300 diapers to families. We also provided the isolation care kits, if you remember those, from the end of December of 2020 through November of 2021. So almost 6,000 isolation care kits were delivered. And then now in 2022, we're continuing to provide those ART stipends. And then finally, in terms of our community vaccinations on the bottom right, we administered, just for our public health run pods, over 260,000 doses, which includes 172 long-term care facilities. Through our DOOR campaign, our direct outreach to our residents, we did over 100,000 door knocks and had over 27,000 conversations, which actually led to a 10% increase in vaccinations right after that DOOR campaign was launched in our priority zip codes. And we were able to work with our community partners in engaging them as well. And we've had points of dispensing at over 52 locations, and that was supported by over 3,000 volunteers and 64 staff. So that's where we've been over the last 1.5 to 2 years. On the next slide, I just wanted to show the curve again where we've been. We've made it through the winter surge of 2021. Then we had our summer surge of the Delta wave that started in July and went a little bit further. And then we just came out of our Omicron surge where we had the highest number of cases. And now we're kind of leveling off, but as Dr. Moss mentioned, we're seeing a little bit of an uptick recently. So on the next slide, I wanted to talk a little bit about where we are going. Our priority is really to keep people from dying, and Dr. Moss was quoted in a San Francisco Chronicle article about how we're managing the COVID crisis. And that's really been our priority all along, is to keep people out of hospitals and keep them from dying. In the beginning, as you know, we conducted universal case investigations. We had health officer orders to reduce the burden of COVID cases on our healthcare system. And we really use data to help us focus on our efforts in communities with the highest case rates and low vaccination rates to make sure resources were available in those areas. And we have always had an equity focus and we continue to be the safety net for many community members. So as we ponder future scenarios, we also want to take into consideration the California Smarter framework, which someone mentioned earlier today. We also have our version of that, what we're focusing on now. We definitely want to learn from our COVID response. And then Kimmy will talk a little bit more about the strategic refresh. So if you go to the next slide, this is a slide that Dr. Moss actually shared in February. So I'm not going to talk in depth about this, but really we really are all thinking about what does the future look like with COVID. And we shared a few possible scenarios, and I'm not going into the details, but we may see continuous waves of COVID that will likely be smaller, or we hope that will be smaller compared to our bigger Delta and Omicron surges, possibly in the winter, but we may also see some small summer surges as we did in July of 2020 and July of 2021. And we definitely are thinking about what is next, and we're preparing for a surge as well as for a calmer period, such as right now, where we are working on prevention and mitigation strategies. So on the next slide is the slide from the state, the California Smarter framework. So much of this is really what we've already been doing all along. We've been providing vaccines, making sure people have access to masks and giving them guidance on masks, what masks are appropriate, making sure there's awareness for people and making sure people isolate when they're sick. We also want to make sure, similar to the state, that there's readiness. You know, as I mentioned, COVID is not going away. We want to make sure people are informed and that we as a public health department are also ready and are trained and ready to respond. Testing will continue to be a need. And as I mentioned, we are wanting to make sure that not only home kits are available, but continued community testing will be available. And we of course want to keep our schools open, so continue to work with our schools. And as someone mentioned earlier, more testing, more treatments are becoming available. So that really falls in line with what we're working on. And on the next slide, I just wanted to dive a little bit deeper into what Alameda County is working on right now. So we are preparing for boosters for our 6 months to 4 year old and continue to provide vaccines to our unvaccinated residents. We continue to provide outreach to our pediatric providers. And right now we're actually working with our California Children's Services providers to do some direct outreach to engage them in signing up for MyCAVax. We are working with our community partners to determine where would be some good pop-up sites to, instead of just having stationary pods, so we can go where the people are who are unvaccinated. And we have expanded our homebound program, our homebound vaccination program, to at-home vaccinations. So basically anyone can call or make an appointment through our web-based platform to make a at-home vaccination appointment. And you don't have to be a homebound resident. As I mentioned, we're going to be making masks available to communities that need those resources. And in terms of awareness, as Dr. Moss mentioned, our Dr. Eileen Dunn is working with us on coming up with a new surveillance plan. We are looking at wastewater surveillance as well, and looking forward to talking to you more about those options. But we're also working with our health promotion and community partnership program that Dr. George Ayala has been leading, and working with our communications team and making sure our dashboards are up to date, so you always have the most up-to-date information. And of course, working with all of you through this community advisory group to get input as well. And in terms of readiness, of course, we want to make sure that we have the tools and resources and supplies available throughout our communities. We're also working with our disaster service worker program to make sure that all of our public health staff continue to get the training and skills needed to be able to search and work with us during a search. And then I talked already about testing. And in terms of education, we are continuing to coordinate with our Center for Healthy Schools and Communities, who have been front and center with the Alameda County Office of Education, working with our children, youth, and congregate settings outbreak teams to keep our schools open and safe. And then I mentioned already earlier about our Test to Treat pilot program that we're hoping to launch soon, which we'll share more about at our next meeting. So that just gives you kind of an overview of what we're doing right now. But as Kimmy mentioned, we are looking forward to refreshing really our strategic plan. So I'm going to turn it over to you, Kimmy, for the next piece of this.
Hey, thank you.
May I, Kenny, before because just what you shared was so eloquent, but since we have a captive audience with regards to the messaging that we're doing, can we not include additional public health issues, cancer, diabetes, and that could be via QR code and or some other resource tactic that we can implement, since we're actually in the field engaging our community. You know, we can hit them with all of the information, make it accessible at one time, and then we get more bang for our buck, prostate cancer, things of that nature, because we are just singularly putting so much emphasis on COVID, while we have all of these other public health issues that are not getting as much attention and that are just as detrimental to our community. And if we can combine our efforts in terms of outreach and navigation and resource, that would be an excellent positive plus.
Yes, absolutely. And we've actually been talking about that quite a bit. We're just catching our breath coming out of Omicron right now, but we definitely want to leverage all of the work we've done, putting up dashboards and sharing data for other, other diseases and other things that affect our communities. So we're definitely looking at that as well. Thank you for that.
And Gary, that actually is a good segue to the conversation that I want to have with you all now. And this is related to the refreshing our strategies around COVID. And so I'm going to take a page from your comments, Gary. Just now you said, that it isn't just about COVID. And so although we are going to be updating and revising our strategies related to COVID, we're really at a different place now, 2 years into this. And so what we are putting together and what we will put together, hopefully with you all, needs to be inclusive of all of the other health issues, inclusive of recovery, inclusive of being resilient, inclusive of overall health and wellness. And so I have a couple of questions I wanted to ask this group. One, the first question is, are you all okay with us dedicating the May meeting to getting your input into if we had a focused and facilitated conversation here around the goals and objectives for our refreshed COVID strategies? Are you okay with dedicating the entire meeting to giving us input into those goals and objectives or into those strategies? That's the first question. If you could just do your box of thumbs, just so we can kind of get a sense. It's a loose consensus.
Can I just ask for clarification? So that meaning that, so the agenda will be set by the county, brought here for discussion, or is there still sort of the opportunity for some agenda setting by sort of community advisory group and with more specific and targeted focus?
That was the next question, which is, so it looked like people are okay with this. No one is opposed to it. The next question is, who among you is willing to work with us to do two things? Plan the agenda for the May meeting and plan how we have this conversation, as well as give us input into the process that we use for updating our goals and objectives. We not only want to speak to this group, we also want to speak to some other groups as well, and would like a few of you to be thought partners with us to help think through how do we refresh those strategies with input from partners, both in this table and some other tables. And so we're looking for volunteers who would be willing to meet with us outside of this meeting to create that focused agenda that you just spoke about, Dr. Abalada, and help us craft a really meaningful meeting. If you could put your name in the chat, if you are interested in volunteering for that, then we can take your name and then we will convene with you to plan the May meeting. So there are a couple of hands. I don't know who was first, but I see John Simmons and Tanya Dennis. John, would you like to go ahead?
Pushed the wrong button. Sorry about that. Next.
Okay, Tanya.
I was lifting my hand to volunteer to be part of the planning.
Thank you, Tanya.
Bruce's hand is up.
Okay, Dr. Gach. Go ahead. Oh, okay, as a volunteer? Thank you.
How is this different than being on the community advisory group? Just so I'm understanding the question. Is this a separate, or are we talking about a restructure altogether?
So a smaller, because it would be hard to plan the meeting with a large group like this. We want a few of you to work with us to plan the May meeting, where we will basically come together, lay out some very structured, sections for the strategic plan and bring it to the May meeting so that we can get feedback in a very structured way, but so that people can really give their thoughts, give their input, and then we can take that information and integrate it back in.
So let me make sure I understand it too, Kimmy, because I think I do. That you're basically asking this group to do two things, which is to help plan that meeting, both in terms of the content, like what will we actually talk about, substantively at that meeting, and the broader process, like what else needs to happen to get input from other parts of the county, of other parts of the community, so that agenda is a jointly set agenda. It's not like the county's agenda. It's like the community working with the county to create the agenda to get to a strategic plan that includes, I would assume, some of the things we talked about early on: mental health issues, school reopening, gun violence, even, like some of the broader things that are that were COVID related, but also broader social determinants of health that we know have been with us for a long time. Kind of what Gary talked about. Is that another rephrase of the, okay.
Yes, that is. And the timeline that I'm looking at is that, I would love for us to have, kind of our solidified goals and objectives by the beginning of the summer. And so a pretty short period of time to just kind of lay out, and it's a living document. And so we've had to massage, what we do over time, this entire time. But that'll give us some good direction that then we will feel that is both our best thinking about a way forward, as well as your best thinking about a way forward for us as well, us together. Does that kind of clarify it, or do we just muddy the water even more, Noha?
Time will tell.
You what?
I said time will tell.
Time will tell. I think here's the other thing I would say too, is that we can probably commit from the African American Response Circle side of this, because we represent several organizations, and maybe at our next meeting we can also have a conversation about what agenda items need to be included in, or how do we frame or shape that agenda for that May meeting. And Kimmy, if you're saying the timeline's a relatively short trajectory to get to something by late June, early July, so this is not like some long, arduous process, but it really is a more streamlined kind of approach to getting it done.
Yeah, it is. Yeah.
Okay.
I also just want to call attention to Gabriela's comment around having community input and thinking about ways that we can sort of, I don't know exactly what that might look like, but thinking about how we can, maybe some of our community partners can, gather community input to see, like, how does this group serve them, right? And beyond some of the organizations that serve them or that provide resources for them, and maybe how do we catch some of the folks who aren't in any of those, aren't being served by those existing organizations or networks. So.
And if I could piggyback on that, Nestor, that was excellent. I'd love for us to be inclusive of our youth in all aspects of mental health, COVID, and the even education, that we can, kind of gear our responses towards undergirding their support, because they are definitely, they have been through quite an ordeal these last 2 years. And so I think we should really put a heavy concentration around it being youth oriented as well, in terms of making sure that population is addressed.
Yeah, I just wanted to flag that, you know, I think this is has been a useful space. I wanted to flag that the website, on the website where it talks about this, is still very vaccine focused. And I do think that part of the importance of the space is that we are still in an active, evolving pandemic, and the community and leaders want to hear status updates on what is going on. And I think that that will continue to need to be the case. But it's a very narrowly focused on the vaccine if you look at the website now. And I think that for a lot of our young people, leading with the or just a lot of our community in general, leading with the vaccine is kind of a hindrance even to engagement oftentimes. And so just in terms of the strategic refresh and wanting more community engagement here in this space, I think we all, you know, have other spaces that we can certainly invite folks to, but wanting to make sure that it is a meaningful space for discussion as well. So just that was something I happened to notice when I clicked on the page, that it's still very vaccine focused, as I've tried to invite, you know, community members here, and folks want to hear these broad questions that are really being discussed.
Yeah. Can I make one other comment? Because I think one of the things that this last couple of comments is leading me to is, if we can come up with a set of questions that can be emailed out to everybody who's been part of these meetings over the last 2 years, to sort of say, you know, because I think about Umoja, you know, the Umoja youth mobilizers with Kim Rose. Kim's not on tonight, I don't think. But all of the various young, you know, groups of folks that have weighed in over the course of this 2 years, and being able to say to them, hey, as we think about our strategy going forward, what are the key issues that you think we should be talking about? What are the key resources that we need to make sure are available in the community? What are the communication strategies, similar to what Noha just said about the website and other ways that we've communicated with folks? That may also give us a head start to the folks that are volunteering to help plan that next, and I would assume it's the next couple of conversations actually, and not just the May meeting. But anyway, just a suggestion.
Great idea, Greg. Thank you. Other thoughts, other questions?
I think, you know, we may want to talk about, I think about the advisory committee that was like this, but at the state level, where there were sort of representatives from different constituents that were sort of seated in the group. And I don't know if that was a thought, or if that was even maybe how it initially started, but making sure that we have a youth representative. Maybe we have a representative from, you know, different sectors, perhaps in the workforce, from the disability rights community, in the education sector, so that we're having representation, and each of those would tend to have also constituents that could, you know, be invited in as well. So it's just a thought.
Absolutely. You know, with the midterms coming up, and again, we should focus our attentions on our political agenda as well. If we can factor that into the conversation in a way that it is appealing, and just kind of heighten our constituencies to be able to make demands from a public health perspective on our public officials. So that can also be an area where we provide attention.
Absolutely. Absolutely. All right. Lots to think about. All right. So thank you all. And I do think we have a few people who have volunteered in the chat. If you did not put your name in the chat, please go ahead and put your name in the chat, even if you raised your hand, just to make sure that we have your name and that we know that you want to participate. And we look forward to our meeting in May. Okay, so it says Lauren has captured. We have Dr. Donna, Dr. Gok, Gary Blodger, and Tanya Davis. Thank you all.
Tanya Dennis.
Dennis, sorry about that.
That's okay.
Tanya, if there is anyone else, and thank you, Noha. Muddy water and all, huh?
And Gabriella, you got Gabriella now too.
And Gabriella. See, that's what partnership is. You just wade in the muddy water with folks. You know, say, come on. She said, I know it's not clear.
You got to get all churchy on us, Kennedy. Like wade in water. It's like what?
Thank you all. Thanks for this.
Cool. All right, I think that's it. Nestor, unless there's anything else you had, just ready for a closeout, I guess. We're right at almost at time, perfectly. I want to thank everybody for the nice conversation. Obviously, if you have other ideas about this next meeting, send a note out to Lauren. She's our point of contact for all of this. And I think that's it for the evening. I just want to thank everybody for all your hard work. Keeping folks safe and healthy, and you stay healthy and safe with your families. And we'll see you back I guess the next meeting is May 10th at 5:30, and we'll see you then. Thanks so much.
Peace and blessings.
Bye, everyone.
Thanks, everyone. Thank you, our interpreters. Thanks all. I'm going to end the meeting.